You seem to have been affected by what we just saw. Mr. Scavera, who's a former steel worker, he's retired, he's on Medicare. His wife isn't eligible for Medicare by age yet. What do you as a Republican say to a fellow like him who worked hard his whole life, is disabled, and can't pay the medical bills of the family?
Well, Chris, the first thing we've got to do as a Republican Party is quit being a wholly owned subsidiary of Wall Street and the corporations that have done exactly what Steve talked about, and that is allow workers at the bottom to make money for their companies and then let a CEO get a pension, get a wonderful bonus, take a trip to the Riviera, and Steve takes a trip to the poorhouse. Not many Republicans are willing to say it, but we better say it or we're not going to win another election for a generation. We've allowed a lot of people in the airline industry, the baggage handlers, the ticket agents, the clerks, take 40% pay cuts. The executives steer the company into bankruptcy. They get a $200 million bonus. And it's based not on capitalism. That's a good thing. But this is sheer, unadulterated greed. And that's not what makes a strong economy. And it's going to ruin not just this country, but it's going to collapse the Republican Party if we don't start standing up and saying that you can't have that kind of economy where CEOs make 500 times that of their workers and call that perfectly acceptable. It's not acceptable. And people like Steve have got to be factored into the equation. I came from a working family. I understand what it's like when you have a dad who has the grub of the day on his hands and never got it off as long as he lived, never finished high school, wanted his kid to do better than him. You know, a lot of Americans have been able to live better because our parents sacrificed for us. You look at a guy like Steve and you realize we better run for president and remember him and not just the folks who come to the high-priced cocktail parties in Manhattan and Georgetown.
Well, that sounds very important, but the question comes down to, I guess, two questions. What do you do to corporations who betray their compacts with their workers formed over many, many decades, and in some cases many generations of families, and basically give it up to some equity firm and drop all the responsibilities because they sell the place? And secondly, what do you do to fellows left behind? No matter what happened, this guy's stuck without health insurance for his wife. Let's go to that second question first. How would you, as a Republican, get this guy health insurance for a wife who's not yet 65?
One thing we've got to do is to change this post-World War II health care system, which is based on tying your health care to your employer. That may have been fine when my dad and people of his generation worked for the same people for 30 years. People don't do that. We need plans that tie to the individual, not to their workplace. I need to own my own health care. I need to be able to get the best doctors that I can. And that's not going to happen if I've got somebody up the company corporate ladder who's looking after the company's interests, not mine. So the first thing is move to a portability based system and a personally owned system. Empower people to have their own health care. Pick their doctors. Bring quality into the equation. Let us know what it's really costing. Give me the power of information to shop as a consumer. Electronic medical records that belong to me, not to my doctor, so that I can carry them with me to the best healthcare professionals that I know that I can get. Chris, we can transform this problem, but you know what's frustrating? In 4 debates that we've had, I can only remember one healthcare question that came up. 2 of us on that stage, Tommy Thompson and me, have been talking about the need to move from an intervention-based healthcare system to a prevention. And I want to give Tommy credit because I don't want to sound like I'm the only voice out there, but there's some of us that are looking at this as a fundamentally upside-down system.
Okay.
It's got to have some transformation.